все.
Вы что, издеваетесь надо мной? Что я вам так сказала?
Ну просто где-то мы все откроем, закроем.
Okay, good afternoon. Today is morbidity of the population. The morbidity is an essential component of a comprehensive assessment of public health. The incidence morbidity describes the prevalence, the structure and dynamics of disease registered in the population as a whole or in its individual groups, age, gender, regional and professional, etc. Morbidity is one of the criteria for evaluating the work of the doctor, medical organization and health authority. Morbidity can be calculated in point of 100, 1000, and so on. In healthcare, morbidity data are used to justify the need for different types of medical aid, personal hospital beds, for the planning of specific therapeutic and preventive measures and targeted prevention programs, to evaluate the medical organization activity, analysis of the volumes, quality and efficiency, including economic activity, to organize and conduct social and hygienic monitoring of disease. Не мешайте, пожалуйста, выйдите. Выйдите, пожалуйста. У меня в среду экзамен.
Сколько здесь?
8:30 на Автозаводской. The methods of studying morbidity. According to citizens' appeals in medical organization, clinic, hospital, according to the medical examination, according to the data on causes of death, pathological, forensic investigations, according to the survey, opinion poll that allows you to explore the subjective attitude of patients to their health. Method of morbidity study according to the citizens' appeals. Negotiability. It is the main source of information about acute diseases and acute exacerbation of chronic disease with which the patient is turned to the medical organization in the current year. Positive aspects of the method. It is the main source of information about acute diseases and acute exacerbation of chronic diseases. This method is economically cheaper than other. The ability to compare the information with the data obtained from the use of other methods for the concrete disease. Method of morbidity study according to the citizens' appeals. Disadvantages. Some people do not seek medical care because of unexpressed disease symptoms, the level of culture, low medical activity of the population, and so on. Different levels of medical care at the individual administrative areas, access to health care, the level of qualifications of doctors, diagnostic capabilities of medical providers, and others. Different quality levels of statistical accounting medical diagnosis in medical institutions. Accounting incidence according negotiability is counted on the basis of statistical processing, registration from coupon of ambulatory patient. Coupon of ambulatory patient is filled with medical organizations engaged in outpatient care and using a system of accounting for the finished case of outpatient care. Coupon of ambulatory patient and its automated processing allows for the collecting of statistical information on the incidence, accounting and management of insurance, compulsory health insurance. Method of morbidity study according to medical examinations. It provides the most complete information about all available at the time of inspection of chronic and acute diseases with clinical manifestations, as well as diseases that occur hidden latent in subclinical forms. Positive aspects of the method. It allows you to identify the early stages of diseases about which people do not seek medical care, hidden. It allows you to identify purposefully the individual pathological conditions and diseases, tuberculosis, hypertension, and others. Disadvantages, weaknesses of morbidity study according to medical examinations. The quality and efficiency of the method depends on the economic possibilities, material and technical base of medical organizations. It is not possible to provide the inspection of all population groups by highly qualified specialists, narrow profile in the conditions of modern Russian health. In order to be effective, medical examination is needed of its clear organization, attraction of highly skilled experts, the use of modern diagnostic equipment. Method of morbidity study according to data on causes of death. Represents information about the disease which caused the death and was not treated in medical institutions during the lifetime of the patient. It reflects the current level of medical science development. It reflects the final result of pathological conditions which cannot be affected, influenced. The morbidity level and its reasons depend on the quality of the diagnosis of the death causes, training of doctors, the state of morbid anatomy service, religious beliefs and traditions of the population. The main indicators used for statistical analysis of morbidity: primary morbidity, the actual incidence, the overall morbidity, prevalence, frequency of diseases, morbidness, the incidence identified in medical examinations, pathological destruction, causes of death are also indicators of morbidity. Primary morbidity, the actual incidence. This is frequency of new diseases that have not been previously recorded. These diseases were first detected in the population in a given calendar year. The indicator of primary morbidity: the number of newly emerged diseases for the year, multiply 1,000, divided to average annual population. The level of primary morbidity in Russia is 900 per 1,000 population. Remember this formula: the number of newly emerged diseases for the year divided to average annual population. Next is the overall morbidity, morbidness, prevalence. This is the frequency of all existing diseases in the population. It includes diseases first identified in a given calendar year, as well as diseases registered in previous year when the patient again sought medical care in a given year. Index of general or overall morbidity: the number of existing diseases for the year divided to average annual population, multiply 1,000. The level of general morbidity in Russia is 1,800 per 1,000 population. This formula also you should know. Так, let's check how many students present today. The incidence identified in medical examinations, pathological destruction. These are diseases found during preventive medical examinations and registered on a given date. The index of morbidity diagnosed during medical examinations. The number of diseases and premorbid conditions identified during the medical examination multiply 100 divided the number of examined persons. Morbidity according to the cause of death. The frequency of diseases with definite causes of death diagnosis established by medical staff when a patient was alive, or at post-mortem examination, or during a forensic medical examination of the population. Incidence rates according to cause of death, the structure of death causes, the mortality of the population in general for specific diseases. Some kinds of diseases subject to special study. Hospital morbidity, hospitalized, infectious, epidemic morbidity, non-epidemic incidence of diseases that have been identified by doctors of dispensers and clinic specialized rooms, professional morbidity, and incidence with temporary disability. Registration records and documents for the study of certain types of disease. Statistical card of the left out from permanent establishment. Emergency notification of infectious disease, food, acute professional poisoning, and unusual reaction to vaccination. Notice of patients with newly diagnosed in the life of active tuberculosis, venereal disease, microsperm, crusted ringworm, scabies, trachoma, mental illness. Notification of patients with newly diagnosed in the lives of cancer or other malignant neoplasms, and disability leave. Level and trends of morbidity may be caused by risk factors for disease occurrence, factors affecting the availability and stages of care, influencing quality of disease diagnosis, skill level of doctors, the provision of diagnostic equipment, changing the composition of the population by age, sex, and other social factors, and organization of preventive work. The International Statistical Classification of Diseases and Related Health Problems. It is a system of disease groups and disease states reflecting the current stage of development of medical science. ICD is reviewed and approved by World Health Organization. Currently, ICD-10 remain in force. Includes 21 class of diseases, conditions, and external causes of diseases, and also the factors. The purpose of the ICD to create the conditions for systematic recording, analysis, interpretation, and comparison of mortality and morbidity obtained in different countries or areas and at different times. International Statistical Classification of Diseases is used to translate the verbal formulation of disease diagnosis and other problems associated with health in the alphanumeric codes that provide easy storage, retrieval, and analysis of data. But you should know that ICD-11 was released by the World Health Organization in June 2018 and will be implemented in member states next year. So it's beginning in 2022. Very, very soon it will be changed. Now we work with ICD-10, but soon all over the world will work with ICD-11. Morbidity frequency measures. Morbidity has been defined as any departure, subjective and objective, from a state of physiological and physiological well-being. In practice, morbidity encompasses disease, injury, and disability. On our classes, we told about this, but you should remember this, so I recall it for you. Incidence refers to the occurrence of new causes of disease or injury in a population over a specified period of time. Although some epidemiologists use incidence to mean the number of new cases in a community, others use incidence to mean the number of new cases per unit of population. So two types of incidence are commonly used: incidence proportion and incidence rate. Incidence proportion or risk. Definition of incidence proportion. Incidence proportion is the proportion of an initially disease-free population that develops disease, becomes injured, or dies during a specified period of time. Synonyms include attack rate, risk, probability of getting disease, and cumulative incidence. Incidence proportion is a proportion because the persons in the numerator, those who develop disease, are all included in the denominator. Here you can see method for calculating incidence proportions or incidence risk. Please check. So, number of new cases of disease or injury during specified period divided to size of population at start of period. Here you can see examples calculating incidence proportion. Very often I give you example for your better understanding. First example. In the study of diabetics, 100 of the 189 diabetic men died during the 13-year follow-up period. Calculate the risk of death for these men. Numerator 100 deaths among the diabetic men, denominator 189 diabetic men, so you can calculate risk. Example 2 also you can see on this slide. In an outbreak of gastroenteritis among attendees of a corporate picnic, 99 persons ate potato salad, 30 of whom developed gastroenteritis. Calculate the risk of illness among persons who ate potato salad. So calculate, numerator will be 30 persons who ate potato salad and developed gastroenteritis. In denominator it will be 99 persons who ate potato salad. So risk equals 30.3%. Properties and uses of incidence proportions. Incidence proportion is a measure of the risk of disease or the probability of developing the disease during the specified period. As a measure of incidence, it includes only new cases of disease in the numerator. The denominator is the number of persons in the population at the start of the observation period. Because all of the persons with new cases of disease, numerator, are also represented in the denominator, a risk is also a proportion. More about denominators. The denominator of an incident proportion is the number of persons at the start of the observation period. The denominator should be limited to the population at risk for developing disease. So persons who have the potential to get the disease and be included in the numerator. For example, if the numerator represents new cases of cancer of the ovaries, the denominator should be restricted to women, because men do not have ovaries. This is easily accomplished because census data by sex are readily available. In fact, ideally the denominator should be restricted to women with ovaries, excluding women who have had their ovaries removed surgically, often done in conjunction with a hysterectomy. But this is not usually practical. This is an example of field epidemiologists doing the best they can with the data they have. In the outbreak setting, the term attack rate is often used as a synonym for risk. It is the risk of getting the disease during a specified period, such as the duration of an outbreak. A variety of attack rates can be calculated. Overall attack rate is the total number of new cases divided by the total population. A food-specific attack rate is the number of persons who ate a specified food and became ill divided by the total number of persons who ate that food, as illustrated in the previous potato salad example. A secondary attack rate is sometimes calculated to document the difference between community transmission of illness versus transmission of illness in a household prereqs or other closed population. It is calculated as number of cases among contacts of primary cases divided to total number of contacts. Multiply 10n. Often, the total number of contacts in the denominator is calculated as the total population in the households of the primary cases minus the number of primary cases. For a secondary attack rate, 10n usually is 100%. Example, calculating secondary attack rates. Consider an outbreak of shigellosis in which 18 persons in 18 different households all became ill. If the population of the community was 1,000, then the overall attack rate was 18 divided 1,000 multiply 100 equals 1.8%. One incubation period later, 17 persons in the same household are these primary cases developed shigellosis. If the 18 households included 86 persons, calculate the secondary attack rate. Я еще не все, подождите немножко, ладно? Secondary attack rate 17 divided to 86 minus 18 multiply 100% equals 25.0%. Incidence rate or person time rate. Incidence rate or person time rate is a measure of incidence that incorporates time directly into the denominator. A person time rate is generally calculated from a long-term cohort follow-up study wherein enrolls are followed over time and the occurrence of new cases of disease is documented. Typically, each person is observed from an established starting time until one of 4 endpoints is reached: onset of disease, death, migration out of the study, loss to follow-up, or the end of the study. Similar to the incidence proportion, the numerator of the incidence rate is the number of new cases identified during the period of observation. However, the denominator differs. The denominator is the sum of the time each person was observed, totaled for all persons. This denominator represents the total time the population was at risk of and being watched for disease. Thus, the incidence rate is the ratio of the number of cases to the total time the population at a risk of disease. Here you also can see method for calculating incidence rate. Number of new cases of disease or injury during specified period, divided to time each person was observed, totaled for all persons. So, in a long-term follow-up study of morbidity, each study participant may be followed or observed for several years. One person followed for 5 years without developing disease is said to contribute 4 person years of follow-up. What about a person followed for 1 year before being lost to follow-up at years 2? Many researchers assume that persons lost to follow-up were on average disease-free for half the year and thus contribute 1/2 to the denominator. Therefore, the person followed for 1 year before being lost to follow-up contributes 1.5 person years. The same assumption is made for participants diagnosed with the disease at the year 2 examination. Some may have developed illness in month 1st and others in month 2nd through 12th. So, on average, they developed illness halfway through the year. So, the denominator of the person time rate is the sum of all of the person years for each study participant. So someone lost the follow-up in year 3 and someone diagnosed with the disease in year 3 each contributes 2.5 years of disease-free follow-up to the denominator. Properties and uses of incidence rates. An incidence rate describes how quickly disease occurs in a population. It is based on person time, so it has some advantages over an incidence proportion. Because person time is calculated for each subject, it can accommodate persons coming into and leaving the study. As noted in the previous example, the denominator accounts for study participants who are lost to follow-up or who die during the study period. In addition, it allows enrollees to enter the study at different times. Person time has one important drawback. Person time that assumes that the probability of disease during the study period is constant, so the 10 persons followed for 1 year equals 1 person followed for 10 years. Because the risk of many chronic diseases increased with age, this assumption is often not valid. Long-term cohort studies of the type described here are not very common. However, epidemiologists far more commonly calculate incidence rates based on a numerator of causes observed or reported and a denominator based on the mid-year population. This type of incidence rate turns out to be comparable to a person time rate. Examples calculating incidence rates. First example, investigators enrolled 2,100 women in a study and followed them annually for 4 years to determine the incidence rate of heart disease. After 1 year, none had a new diagnosis of heart disease, but 100 had been lost to follow-up. After 2 years, one had a new diagnosis of heart disease and another 99 had been lost to follow-up. After 3 years, another 7 had new diagnosis of heart disease and 793 had been lost to follow-up. After 4 years, another 8 had new diagnosis with heart disease and 392 more had been lost to follow-up. The study results could also be described as follows. No heart disease was diagnosed at the first year. Heart disease was diagnosed in 1 woman at the second year, in 7 women at the third year, and in 8 women at the fourth year of follow-up. 100 women were lost to follow-up by the first year, another 99 were lost to follow-up after 2 years, another 793 were lost to follow-up after 3 years, and another 392 women were lost to follow-up after 4 years, leaving 700 women who were followed for 4 years and remained disease-free. Calculate the incidence rate of heart disease among this cohort. Assume that persons with new diagnosis of heart disease and those lost to follow-up were disease-free for half the year, and thus contribute 1/2 year to the denominator. Numerator number of new cases of heart disease 0 plus 1 plus 7 plus 8 equals 16. Denominator person years of observation. You can see calculation and it equals 6,400 person years of follow-up. Or denominator person years of observation equals 6,400 person years of follow-up. Person time rate equals number of new cases of disease or injury during specified period divided by time each person was observed, totaled for all persons. In contrast, the incidence proportion can be calculated as 16 divided to 2,100 equals 7.6 cases per 1,000 population during the 4-year period, or an average of 1.9 cases per 1,000 per year. The incidence proportion underestimates the true rate because it ignores persons lost to follow up and assumes that they remain disease-free for all 4 years. Example: in 2003, 44,232 new cases of acquired immunodeficiency syndrome (AIDS) were reported in the United States. The estimated median population of the US was approximately 290, 809, 777. Calculate the incidence rate of ARDS in this year, is 2003. So using this formula you can calculate, and it equals 15.21 new cases. Next is prevalence. Definition of prevalence. About prevalence we also discussed on our previous classes, but you should remember that prevalence, sometimes referred to as prevalence rate, is the proportion of persons in a population who have a particular disease or attribute at a specified point in time or over a specified period of time. Prevalence differs from incidence in that prevalence includes all cases, both new and pre-existing, in the population at the specified time, whereas incidence is limited to new cases only. Point prevalence refers to the prevalence measured at a particular point in time. It is the proportion of persons with a particular disease or attribute on a particular date. Period prevalence refers to prevalence measured over an interval of time. It is the proportion of persons with a particular disease or attribute at any time during the interval. Here you can see methods of calculating. So all new and pre-existing cases during a given time period divided to population during the same time period. It is a method for calculating prevalence of disease. And method for calculating prevalence of an attribute equals persons having a particular attribute during a given time period divided to population during the same time period. Multiply 10. The value of 10n is usually 1 or 100 for common attributes. The value of 10n might be 1,000, 200, or even 1 million for rate attributes and for most diseases. Here you can see again example. I give you a lot of examples for your better understanding. Calculating prevalence. In a survey of 1,150 women who gave birth in Maine in 2020, a total of 465 reported taking a multivitamin at least 4 times a week during the month before becoming pregnant. Calculate the prevalence of frequent multivitamin use in this group. So you know numerator, denominator. We can calculate prevalence and it equals 40.7%. Next, properties and uses of prevalence. Prevalence and incidence are frequently confused. Prevalence refers to proportion of persons who have a condition at or during a particular time period, whereas incidence refers to the proportion or rate of persons who develop a condition during a particular time period. So prevalence and incidence are similar, but prevalence includes new and pre-existing cases, whereas incidence includes new cases only. The key difference is in the numerators. Numerator of incidence equals new cases that occurred during a given time period. Numerator of prevalence equals all cases present during a given time period. The numerator of an incidence proportion or rate consists only of persons whose illness began during the specified interval. The numerator for prevalence includes all persons ill from a specified cause during the specified interval, regardless of when the illness began. It includes not only new cases, but also pre-existing cases representing persons who remained ill during some portion of the specified interval. Prevalence is based on both incidence and duration of illness. Подождите. Нет. Угу. Prevalence rather than incidence is often measured for chronic disease. Здесь какая? Оставьте. Often measured for chronic disease such as diabetes or osteoarthritis, which have long duration and dates of onset that are difficult to point. Exercise. Now you should do exercise. So try to do it yourself, and at the end I will give you answers. It is according our today's lecture. For each of the fractions shown below, I will show you, indicate whether it is an incidence proportion. We told about incidence proportion, incidence rate, prevalence, or none of the three. A, it will be incidence proportion, B, incidence rate, C, prevalence, and D, none of the above. So let's start. Значит, A, incidence proportion, B, incidence rate, C, prevalence, none of the above. So try to understand what these three tasks and these four tasks. What try to do it yourself right now. Then I will show you answers. And next exercises. So now I think you are ready. Answers for that exercises. First, what number of women who have died through last year from heart disease divided to a number of women initially enrolled Birmingham study? What? A. It equals what? Incidence proportion. A. Incidence proportion. B. Incidence rate. C. Prevalence. And D. None of the above. What second number of women? It is B. Number 3. Task number 3. Answers what? C. Numerator is all existing cases. Number 4. This number 4 task you can see. A. 5. Answer is B. Denominator is B, mid-year population. Numerator is number of new cases among the population. Number 6. C, and number 7 is D. So I think it's clear for you. Ну все, значит, let's check your presence today. Так, do you have questions? If you have, you can write, you can ask all questions. If you have. No questions. Okay, let's finish then.